Dear colleagues, my name is Dr. Hanna Balytska. I'm delighted to present our recent clinical audit titled A Dose of Noncompliance, Bridging the Gaps in the Pre-Operative Medication Management. The audit was conducted at University Hospital Limerick in collaboration with Dr. Uzair Ali, Dr. Marianne Fitzgerald, consultant anesthetist, and Dr. Elmaz Aktachynska. This audit focused on how well our surgical team comply with UHL perioperative medication guidelines, specifically around the management of high-risk medications like anticoagulants, ACE inhibitors, and diabetic drugs, as well as morning of surgery instructions and preoperative documentation. Safe preoperative care depends heavily on precise medication management, yet in practice, especially in paper-based system or emergency situations, this is often inconsistent, so our aim was to identify where we are falling short, and more importantly, how we can improve. So, we reviewed 20 surgical cases, both elective and emergency, from April 2025. The results were eye-opening. Only 70% of patients had high-risk medication appropriately withheld. Morning of surgery instructions, like insulin adjustment, were followed in just 55%. Full compliance with both criteria was seen only in 40% of cases. We also found critical lapses, such as anticoagulants being continued in out of 4 relevant patients and ACE inhibitors being given incorrectly in 40% of cases. Diabetic medications were often not adjusted as well. Documentation was particularly poor. Pre-op instructions were frequently unclear or missing. Elective surgeries had better adherence than emergencies, suggesting that time pressure and communication breakdowns during the urgent admissions are part of the problem. While this result fell short on the 90% of target outlined in UHL own guideline, they provided a clear roadmap for action. In response, we introduced a standardized preoperative checklist, implemented target staff education. We also planning random audits to track improvements, and re-audit is scheduled for July 2026. The takeaway is simple but powerful. In the preoperative settings, noncompliance with even routine medication protocols can quietly increase patient risk. By embedding simple tools like checklists and reinforcing communication, we can close this gap and create safer surgical pathways for all patients.